Office of National Drug Control Policy.
Faces of South Asia. I'm Isha, and this evening we have Arlene Goldstein, and she is the program coordinator for Bay State Community Services of Impact Quincy program. And hi, Arlene.
Hello.
I'm Isha.
And I'm Sophie. Welcome to our show.
Thank you.
Please
Thank you.
share your knowledge of this epidemic that we are facing, not only in Quincy, not only in Massachusetts, but all over.
Well, first I'd like to explain that Impact Quincy is a community coalition whose membership is open to anyone who lives in the city of Quincy. We meet quarterly, but we have our offices at Bay State Community Services. We are a program of Bay State Community Services, which is a wonderful social service agency. And you are welcome to contact us, be part of our mailing list, and keep up to date with substance issues within the city and also the region. So I've been graciously invited here tonight to talk about the opioid epidemic, not only in Quincy, not only in Massachusetts, but it's national. First, let me explain what an opioid is for those of you who may not know. An opioid is a prescription medication that is given for pain. And there are other opioids that are illegal substances, such as heroin. So, in talking about opioids, some examples would be morphine, heroin, OxyContin, Percocet 30s, or what is they're known as Perc 30s, Vicodin, etc. And in the best of all possible worlds, they're given to control pain. But unfortunately, many of these substances are highly addictive, and that is what has brought us to what the Center for Disease Control in Washington, D.C. is calling a national epidemic. Attorney General Holder recently addressed that issue. But Massachusetts and Quincy has been at the forefront of beginning to try to address this monumental problem. So we've come to this from a grant that was written by Impact Quincy that was offered by the Massachusetts Department of Public Health. And this, DPH, Department of Public Health, is famous for their acronyms. And this particular grant, which I may refer to, it was called Mass Call 2. Now, Mass Call 2 began in around 2009 and really ended in 2012, but currently there is a new grant that's being mounted for a regional effort that includes the cities of Quincy, Braintree, Weymouth, Randolph, and Stoughton. And we'll be working on that. So let me talk to you about what's happened here. All the way back in 2007, the Department of Public Health in Massachusetts, the epidemiologists there, were looking at data and realized that there was a definite uptick in opioid overdose. So when the monies became available from SAMHSA, that's the federal branch of substance abuse and mental health, when they were offering money, Massachusetts, instead of 99% of the other applicants, they were applying for underage drinking funds. But because Massachusetts saw that there was a need, they asked if they could use it for opioid overdose prevention. Now, Mass Call 2 was not a grant to prevent people from entering the world of serious drug abuse and opioid addiction. It was to try to stem the tide of all those folks who were dying. And in order to even apply for this, you had to have the dubious distinction of having a lot of deaths in your community. Quincy ranked 7th in the state for the amount of people who died of an opioid overdose. So that's how we came to this. So one of the things that I think is important to say is that Mayor Thomas Koch at the time and who is currently the mayor of the city of Quincy, kept to his election promise of trying to address opioid addiction in the community. And so when this grant came from the Department of Public Health, you had to be linked, in order to apply, you had to be linked to your government, in our case a city government, in other places a town government. And at the same time, Mayor Koch also had established the Substance Abuse Task Force. So Impact Quincy applied for this, and we received it, and we began the work of trying to develop strategies to prevent overdose. So one of the major strategies was education, was beginning to educate community members, folks who were at high risk for overdose, such as folks getting out of prison. And many people, and actually even finding out from our key stakeholders in the community, that to teach them about the issue. Initially, even when we interviewed key stakeholders and we asked them, who do you think uses these drugs and is, addicted to OxyContin, etc., it was very interesting to find out that there wasn't a lot of knowledge in the community at all. And I came to this personally myself with no knowledge of this issue. I came with a history of being an educator and another occupation that I had for a while, and came to Impact Quincy and helped to write the Mass Call 2 grant along with my director, Alejandra Rivera, who is an amazing person and knows so much about public health. So I came to learn about it by reading, and actually doing the work and the outreach in the community. So education began to as many people as we could. And even in the beginning, with Alejandro, we did what we called an opioid 101 to roll call at Quincy Police. And I must say, they were polite and they listened. And they were kind of skeptical. This was just the part of the program in which we were trying to get the education out there. We developed informational brochures and cards, and we did a tremendous amount of work interviewing people who were actively in the life, family members, etc. So this is also a story of many components in the community, and where I like to say the planets aligned. Mm-hmm. So you have, on one hand, you have a mayor who is progressive and open and does not put his head in the sand and will say, yes, there's a problem, but let's dig in and see what we can do about it. And without him, the doors would not have been open in most places. So I totally applaud him. And at the same time, we have community members who also happen to be members of the coalition, but were actively touched by family members who had become addicted to this. Because we have to remember that addiction is not just something you can say no to, like Nancy Reagan used to spout about. Addiction is a brain disorder. When you start to abuse these substances, your brain changes. The electrical wiring, if you want to call it, in your brain changes. You just can't stop. And if you just try to stop without help, you get what is known as dope sick. So going back to, we had two parents especially, who still are very active members in our coalition, who both of their sons were active users. Now I also want to say that these people were solid, middle-class people. Both parents worked. Both took great care of their children. The children were given religious training, sports, you name it. The typical American child,
Right.
wonderful, experiences in their life. But they made bad choices. And so I would like your audience to know that these people who are addicted to these drugs, they are somebody's loved one. They are somebody's son, daughter, father, mother, sister, brother. And this is why I'm so passionate about trying to get people to understand that. They're not bad people. Yes, they've made a bad choice. They could have done something better, but they're in it now. Do we just leave them? And if you hear the stories of the moms and dads, you can't leave them alone. I defy you to leave them alone. It's too sad and too striking, and it impacts the family so much. Whether it's depression or in the entire family. I think even the data says a minimum of 7 people are impacted directly from a user's addiction. And these users themselves sometimes have made these choices that aren't so terrific because they have other issues. Many people are what we call dual diagnosis, meaning that they have other issues of their psyche, whether it's depression or any kind of anxieties, etc. Sometimes they've gotten into it legitimately by accident. There are adults who've gotten into this who have had a surgery or have had back pain or have gotten hurt on the job, and they've legitimately gotten a prescription and they become hooked. And you can become hooked because your genetics may play into it, your family history. And that's just what happens. And once these opiates are very strong, and once they start havoc within your brain, you're in it. And it's very hard to get out unless you have support. And unless the user themselves really, really wants the help. So one of the things that happened while the planets were aligning, going back to the story, was you have the mayor who's on board, you have the police who their job is to protect and serve, and they proudly do. And then we have our parents. So this one particular parent, one of our coalition members actually, they had their son who was using back in the home, promising, I'm going to treatment, please support me, I'm going to go to treatment. The family is downstairs. They hear a bang, a thud. They run upstairs. This father gets there first, and they see this young man, blue, on the floor with a needle in his arm. So this terrific family with his 2 younger sisters, everyone's there, the grandparents live in the house, it's a multi-family home. They call 911. And back in 2009, the police came because we have what's called a tier system in Quincy. When the 911 call comes in, the ambulance and the police go out automatically, and it's just chance who gets to the scene first. So in this particular day, the police got there, no naloxone or Narcan. Naloxone is a medication that reverses a drug overdose, which I will explain in a minute. So the next thing that happened was there are 2 levels of ambulances in Quincy: BLS, Basic Life Support, and ALS, Advanced Life Support. Mm-hmm. So at the time, the police came, no naloxone. Basic Life Support came, no naloxone. 10 minutes has gone by. Advanced Life Support gets to the scene with multiple medicines given, multiple naloxone applications given. The young man is revived, and he lives to go on to treatment. Okay. So let me explain what naloxone is. Opioids, the easiest way that I can explain it when someone takes an opioid, you have opioid receptors in your brain that you can picture as a cup. And as you take the opioid, the cup fills up. As the cup fills up, your pain is being taken away. But as the cup fills up and it overflows, that's when you go into overdose. And an overdose is when someone stops breathing. Their heart is beating, but the automatic systems in the brain click off because the receptors are filled with the drug. So through the magic of chemistry, naloxone is a medication that reverses an opioid overdose. It's temporary. It takes about 1 to 3 minutes to work. It lasts only about 30 to 90 minutes, so that when someone is revived, they must go to an ER for further observation. So this is what it is, and I think that maybe the kit comes with 2 of these vials in it, and this is what is in it. This is a nasal application. These ends come off. Here's the med. The med goes in. The nasal application goes on. That's it. You spray it up each nostril, half on one side, half on the other. Well, it's not going to, well, you can imagine it sprays up half one side, half the other. That's all this is. It goes in the nose. Through the nasal membranes, it's absorbed pretty quickly. So here we are.
And that saves a life.
Absolutely. Right. But it only works for about 90 minutes. So going back to our cups, right. Through the magic of chemistry, the naloxone pushes the opioid off the receptor. And because it pushes the opioid off the receptor, the automatic systems click back on. So, but this hasn't disappeared. It hasn't dissipated. It hasn't eaten it up like a Pac-Man. It's still there, totally. So as it's wearing off and the receptors are exposed again, the drugs reattach and you can go out again, which is why there is a second application in case someone can't get there, or sometimes they've got so much in their system that they need the second one to revive them. Now, people will say, oh, this is going to enable people. The drug user, they're just going to have this by their side, and that's going to be it. Well, that's not how it works. First of all, to be in an opiate overdose, you have to be unconscious. So if you're unconscious, it's pretty hard to give yourself a medication. Somebody else has to be there to do it. And the other thing you have to realize in this very harsh reality of drug abuse is that folks need and want their high. And they don't want to give it up. They've worked hard in whatever way they have to get the drugs to put into their system, whether it's heroin, whether it's pills. They don't want it taken away. But this helps to keep them alive to go to treatment. This kept that young man alive so that his family members could see him go to treatment and try to get better. So what then happened in Quincy was, the family, needless to say, was very upset that it took so long to respond to this emergency. So they contacted Mayor Koch's office and asked for a meeting, which they got. And Mayor Koch then agreed to take the idea of the police carrying, or first responders carrying, to City Council. The City Council approved it, and the Department of Public Health was approached to allow the Quincy police to carry. Now, Mass Call 2 and My Education and Impact Quincy was one piece of the planetary system. The naloxone pilot sites were separate. Mm-hmm. Mass Call 2, I could talk about it in my presentations, I could tell you about it, I could tell you where to get it, but I could not hand you a kit because it's medicine. It came from a person who was trained to explain it, And there's a standing order in the state because there has to be a medical director to oversee the program and to write the script for it. So Massachusetts Department of Public Health agrees. Bay State Community Services, not Impact Quincy, but Bay State, even though the person sat next to me, she was the naloxone pilot site person. So she trained, her name was Jackie Gutierrez, and she trained the 220 police officers. And the Quincy Police became the first in the country to carry and be able to administer naloxone 24/7. And as of today, 250 people have been reversed with this medication. So as the education continued, and we make the community aware of this, we make the community aware of the issue, consciousness is raised, and we try to work on the issue as best we can. And in the meantime, because this has worked in such a wonderful way to save people, it gets national notice. The Office of Drug Control Policy, Executive Office of the President, awarded Lieutenant Patrick Glynn of the Quincy Police an advocacy award, which he received last spring. And it is now this idea of education and police carrying naloxone and just beginning to see what you can do at the grassroots level, because there's other things that are being done, which I'll come to. But what's being done at the grassroots level is now known as the Quincy model. Lieutenant Glynn fields calls from all over the country with people asking how to do this. Because it's not just a matter of giving it to the police, it's a matter of coalition building, of community teaching, of explaining to people what the seriousness of this issue. Because again, you have to remember that this issue, it's also economic. There's a lot of collateral crime that's committed, unfortunately, because people need to find the substances they need to feel comfortable.
Sure.
So it permeates a lot of our community and our culture. And on the other hand, some of the other things that are going on in Massachusetts, if you'd like me to explain
Please.
some of the other things beyond Mass Call 2, and what is now moving into, here we go, MOPSI, Massachusetts Opioid Abuse Prevention Collaborative.
Great.
We love our acronyms. Mm-hmm. We're currently working on that and trying to build strategies, because now it will be a regional effort between the 5 towns that I mentioned. I'd also like to say that Alejandro Rivera, my program director, was instrumental in bringing the idea of reaching out to others and other communities, because he mounted 2 symposiums on this issue where over, I would say, about 100 to 150 community members, professional, police, government, you name it, were at these conferences to learn about the problem. So how else is the state, our community, trying to help people? Well, now that it's really come to the forefront and it's being talked about a lot, there's also something that is within the state that if you are in the medical field, you know about, the PMP, the Prescription Monitoring Program. There's our acronyms again. And what that is, it's an electronic system that dentists, physicians, nurse practitioners, anyone who can write a script, including, and the pharmacist as well, can try to check when people come with a script for an opioid. Mm-hmm. They check to see whether that person has been prescribed this before, if the prescriptions are too close together. In other words, something called doctor shopping. It's really helped to stop that.
Right.
But on the other hand, and a consequence from that is when we have a continuum of people who are at different places, unfortunately, in their addiction. And if you have someone who is totally addicted to pills and you cut them off,
Right.
they have to seek their drug, their substance somewhere else, or else they will become drug sick, which is explained to me as being the flu times 100. It's terrible. It's fever, it's chills, it's nausea, it's muscle twitching, it's the physical withdrawal is horrendous. So that is when people turn to heroin. And also because, for example, OxyContin is not so much available anymore because Purdue Pharma, the manufacturer, devised a formulation that isn't tamperable to be able to crush or melt down for an active user to get a hold of. So, and just to give an example, when OxyContin was available like that, it was probably $40 a pill. It was $1 a milligram. So if you are seriously addicted to something like this, one pill a day isn't going to make it for you. So you can multiply by multiple pills what a person would have to find the money for to get these meds to make themselves feel comfortable. Because initially, when someone is addicted to drugs, there's that initial high, and it's something that they search for. But then after a while, you never get to that point again, from what I understand. So what you're really doing is you're hooked and you're addicted only to make yourself not be dope sick. You are trapped. You are trapped. So then you turn to heroin, because a bag of heroin on the street, $6, $8, $10, depending on stuff. And so heroin use is up right now because the PMP, the Prescription Monitoring Program, and more awareness is causing the supply to dwindle a bit. I'm not a police officer, I'm not a DEA agent, but this is sort of the logic of it all. So that's what we continue to do. We continue to try to educate and build the next phase, which is MOPSI.
So how do you stop an addiction like the heroin? Like, what can you do? Do you put yourself into rehab? Or do you go and, like people are on the street now who are using the heroin because that's what they've gone to. So what happens? Like, what do you help out with?
Well, Bay State Community Services it has, physicians and clinicians who do direct counseling with these folks. My job, I'm what is known in public health as a preventionist. I am the educator. I'm out in the community. I'm not a clinician. I'm not a social worker. I'm an educator.
So you go to schools? Is that what you do? Or?
Well, there are courses, et cetera, that you build your repertoire of knowledge over time, and that is what I've done.
Spread to the community, just
Yes.
what she's doing
Yeah,
right now.
right.
Correct. So if someone is addicted, see, this is one of the issues in the state right now, that the continuum of care for this has to be addressed. And I believe that Governor Patrick, when he was talking about putting $20 million into the budget, I think was trying to address that gap.
Yes.
Because you have your emergency room services, then you have what is known as a detox, and that doesn't last very long. And then these folks need what's known as a bed to go to treatment. And that is what needs to be addressed by the state. And that's where we are now, trying to, this issue has so many components and it's extremely complicated. And it takes a long time to even get through your treatment. And most people, when they are in treatment, I would say that unless you've been what is known as clean with not using for several years, then you can really start to rebuild your life. But even then, it's like any other addiction, whether it's to alcohol or whatever, it's one day at a time. You wake up and you must set your body and your mind and your soul to your new life, to your recovered life, to your life in recovery. And it's not easy. You have, it's not easy.
No, it's not easy for anybody. Whether as a mom, you think about the children, they go to colleges, one by habit, the other by social. It's such a big chapter. Now, you mentioned you have a Mention Talk Back Day.
A Take Back Day.
Sorry, Mention Take Back Day, and then anonymous.
Yes. Let me tell your audience about that. Well, this will be vital information up until April 16th and April 26th. First, April 16th, there's a free showing of a documentary called The Anonymous People, because as you most likely are very aware, there's huge stigma and perception issues with the drug issue, such as thinking that it's so easy to remove yourself from this, that how did they start in the first place, et cetera, et cetera. There's a tremendous amount of stigma. There's a tremendous amount of shame. So even when you have a family that is trying to help their loved one, they don't want to share it with their neighbors. They're sorrowful. It's a gray cloud over their head. So at Weymouth High School, April 16th, AdCare Hospital is graciously providing a showing of an award-winning documentary called The Anonymous People, which addresses these issues, and the public is invited, and it is free, and it begins, the doors open at 6 o'clock, and if you are interested or you need help with this issue, you could come and become educated there. The other is April 26th. This is held twice yearly through the Drug Enforcement Agency, DEA, which is a federal agency, in conjunction with communities. They do what's called Take Back Day. Take Back Day is a free participation. It's held at outside the police station, and it gives folks an opportunity to go into their medicine cabinets and get rid of dangerous substances or any prescription. Many times, you get a script from a doctor and you take a few and it sits there and you say to yourself, well, how do I get rid of it? And then the pharmacy won't take it back. And it's not a good thing to flush it, because our water system, we don't want all those drugs in the water system. So you can take, like if you have old Robitussin, or you have old suntan lotion, or you have old vitamins, any over-the-counter or any prescription drugs, but especially the opioids.
Yes.
You can bring them to the police station. It's a drive-through service. It's quite funny. It's like McDonald's. You can empty all your meds and jumble everything into a zippy, or you can leave them in their bottles and etch out your name because you want your privacy.
Yes.
You don't have to say what's in the bag. You don't have to say who you are, where you live. You just hand it off to the police officer. You'll see me there, and they're collected and they are incinerated by the DEA at Covanta, which is where our trash goes. Now, the other thing is that knowing about what we call medicine cabinet safety is a very important issue. To teach your children from a very early age that the doctor has told you to take this, or mommy has told you to take it, or daddy, and we're taking it the way the bottle says, and we're taking it because we need it for something specific, and to also be cautious of others who may go fishing around in your medicine cabinet. Do you know that at open houses, at sales, people come to open houses to go into the bathrooms to look through your medicine cabinet to see if they luck out and get something of value to them.
Wow, never knew that.
Oh yes, Oh, yes. It's kids. Your kids' friends come over. They go into your bathroom. They go through your medicine cabinet. If there's things that you don't want, don't keep them in that central location. Keep them in a place where you know where they are and you can watch them or be aware of them. Be aware if you got Vicodin because you had oral surgery and you had 15 Vicodin and you took one, there better be 14 in there at all times. If there's not 14 in there, something is not good in the state of Denmark. So the other way is you don't have to wait for a take-back day, which is usually every April, every October. We have, at the police station, I think we can zoom into the picture of it, what is called a med return kiosk. What it is, it's a big green mailbox that takes your over-the-counter, it even takes liquids if, please put the top on tightly, or put it in a zippy. And there it is, it looks like a mailbox, and under the green rectangle kind of in the center is just a drawer that opens, like you put money.
A library.
Yeah, exactly. That's a good way to explain it, like in a library. And the box inside takes it, and then it is in the police station because of the possibility of the controlled substances that people may return to it. This kiosk has been so successful. They are now in every police station in Norfolk County, thanks to Impact Quincy and Norfolk District Attorney Michael Morrissey, who is also a champion of this issue. And they have to empty it several times a week. And what they do is they keep it under lock and key in the evidence room. They don't look through it. They don't categorize it. It's just kind of put into garbage bags. And then at take-back day, because it's just easier, the DEA takes it all. And by the time the DEA take-back day rolls around, just from the med return kiosk, we are probably throwing away 500 pounds of unwanted substances each time. So thousands and thousands of pounds are thrown away through the kiosk and through take-back days. And that keeps our water supply safer and keeps our kids
Safe.
a bit safer.
So people do want to save themselves. This shows that people do want to survive.
Mm-hmm.
And Impact Quincy has been really working towards making that.
Well, we're trying to. It's a difficult issue with many components. We do what we can to educate whoever will listen, and that's what we really hope happens, is that we have improvement in the issue.
Of course. I've learned a lot today. I knew nothing. I did know the names of few of these medicines, but the effects of it is so much. I had no idea.
Yes, it reaches far into communities.
Well, thank you, Arlene Goldstein, for sharing your knowledge, for taking all the time to come and be here at the studio.
And if your audience has a question, they can contact Bay State Community Services in Quincy, Massachusetts.
Absolutely.
And within that, Impact Quincy.
Okay,
Yes,
great.
we have the number of Impact Quincy up on the monitor. And you can contact Arlene Goldstein with that number. Soon my director will put the number up. Thank you. Thank you, Peter.
Oh, it's 617, not 616.
We do have to correct the...
The area code for Quincy, Massachusetts is 617.
Right.
Peter, is it possible to correct Thank you so much.
Perfect.
Yes. So 617-471-8400.
That's Bay State.
That's
and then
Bay State.
That's my extension within Bay State.
And Miss Arlene Goldstein's extension is 155. Thank you once again. It was
Thank you.
a
Thank you
pleasure
very much.
having you. And see you again next time. I'm Isha.
And I'm Soph.
Arlene Goldstein, thank you.
Thank you.